Good day, I'm Rinne Valerio and I'm a student nurse from CAC. And in this video, I will demonstrate how to do Rinne and Weber's test. Rinne and Weber's test are exams that test for hearing loss. They help determine whether you may have a conductive or sensorineural hearing loss, and this determination allows a doctor to come up with a treatment plan for hearing changes. A Rinne test evaluates hearing loss by comparing air conduction to bone conduction. Air conduction hearing occurs through air near the ear, and it involves the ear canal and eardrum. Bone conduction hearing occurs through vibrations picked up by the ear's specialized nervous system. While the Weber test is another way to evaluate conductive or sensorineural hearing losses, conductive hearing loss occurs when sound waves are unable to pass through the middle ear to the inner ear. This can be caused by problems in the ear canal, eardrum, or middle ear such as an infection, a buildup of earwax, a punctured eardrum, fluid in the middle ear, damage to small bones within the middle ear. And now, for the purpose or importance of doing the Rinne and Weber's test is to evaluate your hearing. Ear identification problem allows you to get early treatment, which in some cases can prevent total hearing loss. This test can help identify the conditions that cause hearing loss. Examples of conditions that cause abnormal Rinne or Weber's test include eardrum perforation, wax in the ear canal, ear infection, middle ear fluid, otosclerosis or the inability of the small bones within the middle ear to move properly, and nerve injury to the ears. And for the equipments, I will use tuning fork, and I will make sure that the room is ideally in a completely silent room for Rinne and Weber's test. And now, introduce yourself to the patient. Good morning, sir. I'm Rinne Valerio, and I'm a student nurse from CAC. And now, verify the patient's identity using two verification. Sir, can I ask you to state your name with your birthday?
My name is Rodney G. Villarreal and my birthday is January 19, 1999.
Okay, then now explain the procedure and purpose of the procedure to the patient. Good morning po. So now I will do the Rinne and Weber's test. These are the tests or exams that for hearing loss. They help determine whether you may have a conductive or sensorineural hearing loss. This determination allows a doctor to come up with a treatment plan for a hearing changes. Don't worry because this is a non-invasive procedure. It causes no pain and there are no risks associated with them. The information that will provide determine the type of hearing loss that you may have, especially when the results of both tests are used together.
Perform hand hygiene to reduce bacteria to the hand. But first, let me remove my watch before performing the hand hygiene. We do hand hygiene because it is a key of washing our hands to make sure that we thoroughly clean all surfaces and areas of our hands, fingers, and wrist. And now I'll perform the 7 steps of hand hygiene according to who. First, wet your hands with clean, preferably running water. Then, apply soap to cover all surfaces of your hands and wrist. Then, lather and rub your hands together briskly and thoroughly. Rub your hands palm to palm in a circular motion. Then, clean the back of each hand with the palm of your opposite hand. Then, scrub between your fingers, interlocking your fingers and rubbing back and forth. Then, clean the back of your fingers by rubbing your interlocked fingers into your palm. Then repeat for both hands. Then clean around each thumb with the opposite hand. Rub your fingertips into the palm of your opposite hand and repeat for both hands. Then rub your fingers into your palm for both hands. Then wash each wrist with your opposite hand then rinse thoroughly with preferably running water. Then after completed this hand washing or hand hygiene technique according to me, dry your hands using a towel. And use a towel to lock the faucet. Then discard the towel properly.
Now for the procedure, how to do Weber's test. To perform Weber's test, strike the fork against knee or elbow Then place the base of the fork in the midline, high on the patient's forehead. So this is the tuning fork. I'll strike it in my elbow. Then I'll place it in the midline of the forehead of the patient. Then it is important to steady the patient's head with your other hand so that reasonably firm pressure can be applied. Then now I will ask the patient, sir, do you hear the sound louder in one ear than the other?
No.
Okay. First, I will explain the procedure to the patient. Sir, I'm going to put this vibrating tuning fork in two positions. One touching the bone near your ear, then one a short distance from the ear. I want you to tell me which position you hear the tuning fork loudest in, okay?
Okay.
Okay, then now I will strike a tuning fork and places it on the mastoid bone behind your ear. Okay, then I'll place it. Okay, then when you can no longer hear that sound, kindly signal me. Is that okay with you?
Yes.
Okay, and now I will allow to stay there for 2 to 3 seconds to allow them to appreciate the intensity of the sound. Then next, promptly lift the fork of the mastoid process and place the vibrating tips about 1 centimeter from the external auditory meatus. Okay, now I'll move the tuning fork for next to your ear canal. Can you signal me again if you're no longer hear the sound? Is that okay with you?
Yes.
Okay, then now I will record the length of time you hear each sound. Okay, and now to the right ear. I will first activate the tuning fork by striking it in my elbow. Then I'll place it into the patient's mastoid process. Okay, sir, can you tell me again if you can no longer hear that sound? Can you signal me? Is that okay with you?
Yes, of course.
Okay. Allow it again to stay there for 2 to 3 seconds to appreciate the intensity of the sound. Then now I will move the tuning fork for the next to your ear canal. Then can you tell me again if you can no longer hear that sound? Then can you signal me again? Is that okay with you?
Okay.
Okay. Then now I will record the length of time you hear each sound. And now for the results. The Weber's test is normal. The patient's hearing produces equal sounds in both ears, but if there is a conductive loss, it will cause the sound to be heard best in the abnormal ear, but if there is sensorineural loss, it will cause the sound to be heard best in the normal ear. And for the relay test results, it is normal. The patient's hearing shows an ear conduction time that is twice as long as the bone conduction time. In other words, I hear the sound that next to his ear twice as long as I hear the sound behind his ears. But if you have a conductive hearing loss, the bone conduction is heard longer than ear conduction sound. And if you have a sensorineural hearing loss, ear conduction is heard longer than the bone conduction but may not be twice as long.